Good afternoon and welcome everyone. I'm Lloyd Minor, Dean of Medicine at Stanford, and it's a great privilege to welcome to Stanford this afternoon Vice Admiral Vivek Murthy, Surgeon General of the United States. Dr. Murthy received his undergraduate degree at Harvard and then his medical and MBA degrees from Yale. He did his residency in internal medicine at Brigham and Women's Hospital and then stayed on the faculty of Harvard Medical School and Brigham and Women's as an instructor in clinical medicine. He has accomplished many things in his career prior to becoming Surgeon General, and of course now even more as Surgeon General. Among his accomplishments, he founded Doctors for America, a group of concerned and engaged physicians and other health professionals, medical students, looking at disparities in healthcare delivery in our country and at new, novel, innovative approaches to addressing those disparities. He was confirmed by President Obama to be our Surgeon General, and it's a great privilege and pleasure to welcome him here today. Dr. Murthy will make some remarks, and then Dr. Abraham Verghese will lead a Q&A afterwards. Thank you all for being here. Vice Admiral Murthy.
I want to first of all thank Dean Minor so much for the warm welcome. I want to thank Abraham Verghese as well, who is well known to all of you, but a personal hero to me for many years. And I just want to thank all of you for coming out today and for participating in what I hope will be a fun and engaging conversation. I should tell you that I have been trying to come to Stanford for a very long time. And when I mean long time, I don't just mean a couple of months. I mean actually literally since I was in high school. I tried to apply to Stanford when I was in college, but it was vetoed by my mother, who was scared about earthquakes. So couldn't quite make it then. And at many other times in my life, I have tried to come to Stanford, but never quite successfully. So it took a while, but I am so happy to finally be here with all of you. And one thing that has struck me these past few days, as we've been in California, traveling from Southern California to Northern California, visiting businesses, universities, community organizations, and hospitals, is that this is truly a nation of immigrants, whether you came here a few years ago or a few centuries ago. And my story is part of that immigrant story that makes up America as well. My parents left India in the 1970s, looking for what many immigrants were looking for, which was a better life, a better education, and better opportunities for their son and their daughter. And we settled in Miami, Florida, where my mother and father set up a medical clinic, a primary care clinic, where together they built extraordinary relationships with patients over the years. Those relationships sustained them, they informed them, and as it turned out, they also inspired my sister and me to both go into medicine. As kids, we spent a lot of time in the clinic, opening mail, cleaning the office over weekends. We opened letters from insurance companies and saw the crazy things that insurance companies would write to my parents. We also got a chance, though, to talk to the patients who came, and we talked to them as they left. And what we got to see were these incredible relationships that were being built. We didn't understand the science, but we could see that the relationships were therapeutic for the patients, but they were also therapeutic for my parents. And that's what inspired us to want to go into the profession. But my parents also did a couple of other things for me, which were very helpful, which is that they encouraged my sister and me to act on our ideas, even when we were young. And it's because of that that we both got starts in public health very early in life, often by trial and error, building nonprofit organizations, later building a technology company. But all of them were the result of encouragement from my family from a very young age. And perhaps most importantly, my parents inspired me to serve. They didn't do that through words, but they did it through their own example, through the service they provided in their community. And that, really more than anything else, is the reason why I'm standing before you today. When I was sworn in a few months ago, the vice president remarked, and he made a statement that I'll never forget, but he said, if you think about it, in few other places in the world would the son of a rural farmer in India be asked by the President of the United States to serve the health of an entire nation. And that in many ways is the glory and the beauty of America. So I will always be grateful for that. Since becoming Surgeon General, though, I've spent the last 10 months traveling across the country, going to small towns and big cities, hearing directly from people about the challenges that they're facing in their lives. And I've heard extraordinary things, much of which I want to share with you today. I want to, in fact, tell you what I've seen, what I've heard, what I've learned. But I want to talk to you really about what it's taught me, about the challenges that are facing America, but also about the opportunities that are before us. And I want to talk a little bit about the role that all of us have to play together to build a foundation for health in this country, a foundation that will enable our country to be ultimately what it needs to be, which is a shining beacon of light for its citizens and also for the world. There are two big things that I've learned that I want to focus on. One is the fact that we face an overwhelming burden of disease in America, but most of it is preventable. This is a lesson I saw very early on when I practiced medicine just straight out of medical school. I saw that many of the patients who came to our hospital, and I was at Brigham and Women's Hospital at the time, many of the patients who came to us had conditions that I realized were preventable. And time after time, as an intern, then later as a resident, and later as an attending, what I saw was that if we had only did a better job on the outside before patients came to the hospital, they wouldn't have to deal with so much suffering, they and their families, and the system wouldn't have to deal with so much cost. We all know that chronic diseases, many of which are preventable, are an incredible challenge facing America right now. Nearly 50% of Americans have a chronic illness, like diabetes or heart disease. Chronic diseases account for 7 out of 10 deaths in America, and they account for over $1 trillion in healthcare costs. This is an extraordinary burden. But again, much of it is preventable. We invest as a nation a great deal in treatment. We invest time, energy, and resources. And for that reason, we have some of the greatest treatments in the world. For that reason, our research enterprises, our hospitals, and our clinics are the envy of much of the world. But we invest relatively little in prevention. And as a result, we pay for it much later, often in the form of chronic illness. But that is something that we can change. I remember often a young woman that I saw when I was early in my years as an attending, a young woman who was perhaps in her early 30s at the time, in fact, very close to my age when I first met her. She had developed obesity at a young age and diabetes even before she was old enough to vote. And she struggled with these illnesses for many years, developing the complications of diabetes, recurrent episodes of infection on her leg, which became more and more resistant to treatment. But one thing that struck so many of us as we cared for her was that perhaps her situation could have been preventable if only we had served her better, not as individual physicians alone, but as a society, as a community. It turns out, as many of you know, that the environment around us drives so much of the choices that we make around illness. Environment is inherently linked to health. And one thing that we realized time and time again when she would come into the hospital was that without changing her environment, that we were really never going to be able to change her health outcomes and her experiences. And that was an important discovery, but one that we often didn't know what to do about. The second thing that I learned that I want to share with you is perhaps an even greater and more vexing challenge. And that's that many people that I've met across America are starting to lose faith in their ability to improve their own health. More and more, people feel that their health is less and less in their control. They feel like it's the food industry, hospitals, the government, the health insurance industry, large forces that are beyond their control, that are in fact driving the factors that ultimately decide whether or not they're healthy. People feel like they have lost agency when it comes to health. And this is something that we have to fix. So how are we going to solve this problem? Well, I believe that to solve these problems, ultimately we have to build and create a culture of prevention in America, a culture that is rooted in active living, in good nutrition, and in emotional well-being, a culture that fends off the threats to health, including tobacco and prescription opiate abuse, which is a growing problem all across America. But I also believe that we have to create a culture where people feel engaged with their health and empowered to make decisions that will advance their health. This is the kind of culture that we have to create together. And I want to touch a little bit on these three core elements of that culture of prevention: nutrition, activity, and emotional well-being. Nutrition is one that touches all of us, obviously, something that many of us, being in the health field, have thought about. And we know that the challenge with nutrition is really twofold. One is, how do we make healthy choices more accessible to people? The woman I care for in the hospital, who I mentioned earlier, eating a healthy diet was not a simple proposition for her. Because when she went out in her neighborhood and shopped for food, she often found that healthy foods were not available in the stores around her, and the few items and choices that were available were far beyond her means. They were too expensive. But we have to do that more than make healthy options accessible. We also have to make them appealing. All of us know that simply having healthy options next to unhealthy options may increase the likelihood of choosing the healthy option. But if people still equate healthy with doesn't taste so good, then we're going to make only limited progress. And I have met with small business owners and large companies that make food who have told me that they hesitate to call their food healthy for fear that people won't choose it because they'll assume that it doesn't taste very good. So we have to eliminate that false choice that still exists in people's head, where they feel that they're choosing between healthy and tasty. We have to make healthy options both accessible and appealing. And there are groups that are trying to do this all across America. They're often working in small pockets. They're often struggling in isolation. But what they need is a light shined on them. What they need is collaboration and support from the outside. One such group I met in Roanoke, Virginia, when I was doing a listening tour when I first began my tenure. And this group was called the Healthy Chefs Program. What they were doing was recognizing that kids often didn't even know how to identify many fruits and vegetables that you and I may take for granted. So they began by taking fruits and vegetables into the classroom, teaching kids what they were, teaching them their names, but then going beyond that and helping the kids prepare foods with those fruits and vegetables. At the beginning of their work, they surveyed the children and asked them what their top 3 favorite foods were. And you can probably guess what those top 3 were. But they included pizza, hot dogs, and macaroni and cheese. At the end of the program, though, they asked the kids again. And while the big 3 had not disappeared entirely, in many cases they had been replaced by some of the foods that the children had tasted and come to like. And then the kids went one step further, which is they went home and started asking for that food. And the parents turned around and said, well, what are they teaching you in school? We don't know what these things are. And then the school was ready. They were prepared to teach the parents as well about where to get the foods, the ingredients at affordable prices, and how to prepare those dishes that their kids liked. This is a great example of innovation that's happening at a small level, but one that could be scaled up. So nutrition is important, but physical activity is also important. Sometimes in our country, we like to think that complex problems require complex and expensive solutions. But walking stands out as one of the simplest, most available things that we have in our grasp, that if done, in fact, if done just 22 minutes a day, on average, can help reduce your risk of diabetes and heart disease. And at a time where we're working to develop expensive medicines to reduce people's risk of those 2 illnesses, think about something as simple as walking for 22 minutes and how that compares in terms of cost and convenience. So this is one of the reasons why a few weeks ago from our office, we issued a call to action from the Surgeon General's office on walking and walkable communities, drawing attention to the powerful impact that walking can have on health, but also drawing attention to the fact that 3 out of 10 people in America right now live in neighborhoods where they don't even have sidewalks. And for many people who are living with disabilities, simply going out and wheelchair rolling is not the simple proposition that you and I think it might be. So to make America a place where everybody can safely walk and wheelchair roll, we need not just for healthcare and public health people to speak up, but we need for local government, for city planners, for law enforcement to work together to create safe, amenable spaces for physical activity. So physical activity is important, and we've been talking a lot about it over the last few weeks. And in fact, just this morning, we spent some time at an elementary school in San Francisco, to celebrate International Walk to School Day. I bet many people didn't know it was actually International Walk to School Day. But it is. And at this school we visited, a wonderful elementary school, kids, we actually got together with a group of children and walked with them to school, a walking school bus, if you will. And it was a great experience. I got to talk to kids about whether they like to walk or not. And almost universally, kids said, we love to walk. We love to get out and jump around and hang out with our friends and walk with our parents to school. And what San Francisco is doing to try to not only encourage that kind of walking, but ensure that the streets are safe for kids to walk, this is a powerful combination of actions that we need in communities all across America to ensure that kids are walking from an early age, to ensure, in essence, that we are reclaiming the culture of physical activity that we once had in this country and which we desperately need now. The last item I want to talk about with regard to a culture of prevention is emotional well-being. Just like health is not the absence of disease, emotional well-being is not merely the absence of mental illness. Emotional well-being is something that we can cultivate actively. We are not always the victims of circumstance. Our happiness is not solely the result of what things happen to us and what is done to us. But there are things we can do, from exercise to gratitude exercises to mindfulness-based meditation practices, and a host of other things that have been studied and written up, which can improve our sense of emotional well-being and even our perception of physical symptoms. These fall in the category of what I like to think of as simple, inexpensive tools that can help us rebuild a foundation for health in America. And if you doubt that this kind of culture of prevention is possible, then I would love it if you could travel with me on the road, because you would hear stories every day of how communities, despite the great challenges we hear about and read about in the newspapers, are actually innovating, are on a small scale finding ways to build prevention into their day-to-day lives. And you may also know about blue zones, about those areas all over the world where people live far longer with a higher quality of life than we do in the United States. These are in places like Okinawa, Japan, and even in some places here in the United States, places in Costa Rica, in Greece. And when you look at these areas and you look at the people and the culture that they've developed and you look at what they do, what you see is that they have built a culture of prevention, one that is grounded in good nutrition, in active living, and in emotional well-being. In our office, we are working hard to advance this culture of prevention. We're doing it actually using two approaches that we want to run through every initiative that we build. One is an approach that's centered on modernizing how we communicate. The Office of the Surgeon General has traditionally produced reports and thinner versions of those reports called call to actions. But what we realize is that in 2015, if we want to get important messages to as many people as possible, we need to use a variety of messages, we need to use a variety of messengers, and we also have to use a variety of platforms to reach people where they are. And that's what we've been doing over these past few months. This is what we are looking to expand. But in addition to communication, we are also looking to go beyond the dissemination of information, to work directly with community organizations to translate information into change. All of us know all too well that information isn't enough, that it takes more than knowledge to create change in our lives. And that's why we want to work with groups on the ground to figure out how to translate information about health into actionable items, into real change that can improve outcomes. You know, public health, sometimes people think about public health as something that is the purview and the prerogative of a small group of people who have done MPHs or doctorates and have dedicated their lives to responding to epidemics and making sure our sewer systems don't get us sick. But public health is far more than that. Public health is everybody's business because the health of the public impacts all of us. And that means that if we want to build a culture of prevention in America, that we need everybody to participate in that. We need employers and faith organizations, educators, as well as traditional healthcare players to be a part of that. If you think about it, the food in our workplace, for example, has a big impact on our nutritional intake, especially if you spend 8 or more hours there. So employers have a role to play in improving health. What we hear about in church or in synagogue or in our mosque or our temple on Sundays or Fridays or Saturdays can shape how we think about mental illness, about how we think about other health-related issues. Whether or not kids have the opportunity to be active in school, an issue that is so important at a time where physical education is disappearing from classrooms all across America, that opportunity to be active has an impact on a child's attention span, on their ability to perform in school, and yes, ultimately on their health. So we start to quickly see that to create a culture of prevention, we need the engagement of every sector in America, and that is our goal in engaging communities in translating information into action. I want to say a couple of words particularly to the medical professionals, though, who are here, which I understand is probably most of you. But what I want to say is that we have a particular responsibility to go beyond treating individual patients in front of us and to safeguarding the health of the communities in which we live. That is a different but related responsibility. It's an important one that we used to have centuries ago. It's how people looked at physicians, not just as people who healed individuals, but as people who looked out for an entire community and safeguarded their health. But over the past few decades, something has changed. And healthcare providers and physicians have become more removed from the communities that they serve. And in a lot of ways, we have lost our understanding of who patients are beyond their illness. We've come to see people as the diabetic patient in room 12, or the patient with cellulitis in room 32. We don't understand not just who they are in terms of their own story, but what the forces are in their community that have driven and contributed to their illness. And I think we have to get back to understanding who our patients are outside the hospital. We have to embed ourselves more in the social fabric of our communities if we want to understand where our patients are coming from and how to ultimately contribute to preventing their illnesses in the first place. But ultimately, I also believe that we have to reclaim our role as civic leaders, people who understand not just the causes of illness, but who can be voices for patients when they have lost their voices, when they can't speak up. And we often, in academic institutions, but in medicine in general, we're used to seeing success in a particular way. We're used to measuring success with treatments that go well, with lives that are saved, with research that is published in a top-tier journal. Those are all important. Many of us, if not all of us, have been driven by those at different times in our career, if not for most of our career. But we have to widen the definition of success. We have to go beyond this and actually recognize that success also entails being a leader in your community, somebody who can speak up compellingly for a larger vision around health, and who can convene and bring people together across sectors to make that vision real. Ultimate success, I believe, doesn't just end with treatment, but it ends with ensuring that patients never have to walk through our door in the first place. That's real success. That's the kind of success that we're after. I want to end by just sharing one last thought about these challenges in context. All of you lead busy lives. Many of you are studying very hard during the day. Others of you who are faculty members are working hard to teach, to provide patient care, to do research. Through all of the work that you are doing, you are making incredible contributions. And when you hear about the extent of challenges we face as a country, it can seem overwhelming. It can seem like, gosh, isn't that somebody else's job? But the truth is that while the challenges we face are big, they are not bigger than our collective will. And that's something that we must firmly hold on to. And if you ever doubt that, if you ever doubt the power of our collective will, I would just remind you of what history has taught us. Because it was collective will that enabled a small band of colonists to stand up to the mighty British Empire and actually win. It was collective will that allowed us as a country to face down unspeakable violence and racism and pass the Civil Rights Act in the 1960s. And it was collective will that allowed us as a country, just 30 years ago, at a time where we were facing extraordinary challenges with HIV, to rise to that challenge and to do things like passing the Ryan White Care Act. Now, some of you may be familiar with Ryan White. He was a son of Indiana, a young man from Kokomo, Indiana. And Ryan was a young man who unfortunately grew up with hemophilia and required many blood transfusions. And unfortunately, he contracted HIV through one of those blood transfusions. Now, Ryan faced extraordinary prejudice and hate, not just from the people he didn't know, but from the people in his own community, in his own school. And in the face of all of that, he could have retreated. He could have become bitter. But he didn't. In the face of all of that, he actually stood up as a leader and used his voice and his example to help teach people around him about HIV, about what it was, and about what we must do as a country to address it. The other day, just a few weeks ago, I had the opportunity to attend the 25th anniversary of the Ryan White Care Act and to share some remarks at the White House, where gathered there were the lawmakers who helped pass the Ryan White Care Act, the staffers who worked behind the scenes day and night for many months to make it a reality. And there also was Ryan's mother, Jeannie. And as I spoke with her and spoke with the crowd that had gathered there, I was reminded that it was Ryan and his mother, Jeannie, who allowed us as a country, who mobilized us as a nation to gather our collective will and to address HIV at that time. So the question that lies before all of us today, as we think about our day-to-day lives and the careers that lie ahead of us, the question before us is, what kind of nation do we want to create with our collective will? Well, I want us to be a nation where every man, every woman, and every child has a fair shot at good health. I want us to be a country that opens doors of opportunity to all children, not just the ones who are born in well-to-do neighborhoods, but the ones who are born in underserved communities and who come to us from distant shores as well. And I want us to be a country that puts the American dream back in the reach of everyone. The American dream was what brought my parents and so many of our families and our ancestors to this country. But for too many people, it is beyond their reach. And for too many people, health, or the absence of health, is the reason that that dream is beyond their reach. But we have an opportunity to correct that. And what I've described to you is not just a theoretical America, but it's an America that's even within our grasp. It's the America that we can build. It's the America that we must build. And as your Surgeon General, it will be certainly my privilege to work with you on translating this vision into something that's real, not just for the people in this room, not just for the people in Palo Alto, but for people all across America. Thank you so much.
Thank you so much, Dr. Murthy, for those wonderful comments, and welcome to Stanford.
Thank you. It's good to be here.
Your message really resonates with us because Dean Miner has championed something different from precision medicine, that is precision health, trying to bring to bear all the best that Stanford has to offer earlier in the game when people are healthy and trying to keep them healthy. So I think you're going to find in us very willing partners, and your message is terribly important to us, so thank you for that. You also have here our medical students turned out in force, and many of our community, I think because you really are a hero to all of us, and so it's very special for us to have you here. I'm going to start this off with a few questions, and then we're going to invite people to come to the microphones to ask their questions, if that's okay with you.
Sure.
And I'm going to ask that it be questions and not speeches, if you don't mind. And we're especially going to encourage our students to come first, because I think they're the ones who've really want to ask you things. But I'm going to start off by saying how much it struck me how involved you've been from the earliest times with what we now call social entrepreneurship. You started Visions Worldwide when I think you were just a medical student at the time. And then you began Doctors for Health, and then later the platform for clinical trials. Talk a little bit, if you wouldn't mind, about social entrepreneurship and the spirit that drove you to do that, and what advice might you convey to our own students who are busy with ventures very much like that?
Well, thank you for that question. And I know that on this campus, more than any other, that there are people who are engaged in ventures outside of their day job. So, I got involved in doing work outside of my studies, building nonprofits and companies and such very early on because of my parents, because they encouraged me from very early on to act on my ideas. My father had this thing he always used to say to me and my sister, which would frankly annoy the hell out of us a lot, but he was right. Whenever we had an idea and we were making excuses for why we couldn't do it, he would say, "Don't be a backbencher. Step up and just do it." And that backbencher term, he would say all the time, and it came out of his experiences as a child in India, learning in very small classrooms that just had long benches in rows that kids would sit in, and the kids who wanted to make excuses and didn't want to participate would sit in the very back. So he encouraged us and pushed us, as my mother did from a young age. And as I've thought about it, and you asked what sort of advice would I share, I would share probably a couple of things that I learned from him and things that I learned along the way. And these were lessons I learned not always by living them, but sometimes by not living them and then recognizing the importance of that. The first lesson was to take risk. One of the things I feel very strongly through my conversations with students and reflecting on my experiences is that we tend to overestimate how much risk is involved in our lives, in the decisions that we make. For example, when I was in residency and I was finishing up and I wasn't sure what to do, the prospect of taking a year to figure it out felt just enormous. Like, oh my God, what would happen if I step off the track? I would never be able to get hired into an academic job ever again. Like the specter of what could be and what the downside is often much, much bigger than it really is. And the truth is, for many people in this room in particular, you have far better a fallback plan than probably 99.99% of people in the world. So, life isn't so bad, and that gives us it gives us the permission to take more risks than sometimes we allow ourselves to. The second lesson that I would share is about thinking short-term and not long-term. When I was training, there was one of the first quick questions advisors would often ask is, okay, so what's your 5-year plan? What's your 10-year plan? And there's merit to thinking long-term. There's nothing wrong with that, absolutely. But sometimes we get so engrossed in our 5-year plan that it becomes our identity, and we lose track of feeding something that's much more important inside of us, which was the need to be fulfilled in what you're doing today. And as somebody who became a professional at deferring gratification, over the years, as many of us have, I realized during some critical points in my training when I was trying to figure out what to do next, I came to a point actually after residency, because there's something about residency that just changes you emotionally, and you hope it changes you for the better. Sometimes it's not the case. But in my case, what happened was actually for the better, which is that I realized going through residency and going through these intense emotional experiences and seeing patients at these incredibly vulnerable times in their life and seeing lives lost, I realized that life was too short to wait and hope that the good thing would come 5-10 years down the line. And I'm not making a pitch for hedonism, but what I'm making a pitch for is following your dreams today and pursuing the things that you are truly excited about, even if they have zero connection with what you might be doing now or with that 5-year plan that you put together at the request of an advisor. And the third and final thing that I would share is to keep your anchors close to you. Now, what do I mean by that? I believe like everyone needs anchors in life, the people or the practices that keep you grounded, that help connect you or reconnect you in some cases to your identity and your values at those tumultuous times in life where you aren't sure who you are or where you're going. And for me, I was blessed to have my sister, my mother, my father, and some close friends who remained my anchors. And those people became people who I went to, who reminded me of my journey when I was straying. And the great thing about your anchors is that very often if you invest in those relationships, if you spend time with your anchors, they remain anchors with you throughout. Sometimes they will show up in your life in other ways. One of my closest friends, who was one of my anchors for many years, later became my director of science and policy, who's right here, Nesleen Barmal. So your anchors are very, very important. And to this day, one of the things also that residency taught me about anchors was that investing in your anchors, in the people you care about in your life, isn't something that can wait until the day after tomorrow or a week from now, or whatever it is. And I made a decision in residency that even though it might be hard and expensive, that I would go visit my family, for example, once every couple of months, even if it was just for 24 hours or 48 hours, and just spend some time with them. So those are some pieces of advice I might share. But certainly, I think many of the folks in this room have the ability to create more change in a short period of time than most people on this planet. And I certainly hope that you use that opportunity well.
That's great advice. Thank you so much. You outlined many initiatives. The one that all of them interest me, but the one that particularly excites me is last week you talked a bit, you released, I think, a news alert that you were going to take on the problem of substance abuse, and which is really huge. I think it particularly concerns us because we see the medical consequences, but perhaps we are even responsible indirectly for some of the present state of prescription opioid abuse. Can you talk a little bit about that initiative and how it might relate to us as physicians here?
Absolutely. I'm so glad you asked. On Sunday in Washington at a big rally, a national rally on the Mall, we announced that I will be next year releasing the first ever Surgeon General's report on substance use, addiction, and health. It might surprise you that there's never been a Surgeon General's report on this topic, but what isn't surprising to you, being in the health field, is that substance use and addiction are problems that are ravaging our country. You see it in our emergency rooms. You see it in the stories you hear from friends and family. And there are a few things that we're hoping to achieve through this report. One is that we want to change how people think about addiction. We want people to stop thinking about addiction as a moral failing and to start seeing it for what it is, which is a chronic condition that we need to treat with compassion and with urgency. Same way we think about diabetes or heart disease or other chronic illnesses. The second thing we're hoping to achieve from the report is to actually convene a much broader set of community partners than has to date been engaged in the effort to address substance use. It's the same motif that an approach that we're taking in every campaign that we build, which is to say, how can we use the convening power of the Surgeon General's office to increase the size of the coalition that's working together to tackle big challenges? And you can't find challenges that are much bigger than substance use and addiction. And the final thing that we're looking to achieve through this report is to bring together the best possible science on not just treatment and recovery, but also on prevention. Because as we know, if we can prevent addiction in just one person, then we are not only helping improve their lives, and in many cases returning somebody to society in a much greater level of productivity and contribution, but we are improving the lives of so many people around them, friends and family who love them, who often are impacted so deeply by others who have substance use concerns and addiction issues. So this is what we're hoping to achieve through the Surgeon General's report. As I said earlier, when we say report, we think about something that's more than a sheaf of papers that sits on a shelf. But we think about a living and breathing document that's actionable, that is a document that brings people together and that helps chart out a path for how we can tackle an important issue. And substance use is one of those.
Thank you. I'm going to make this my last question, and I'll invite people to start coming to the microphones. When we've met before, I've been so struck not just by how articulate you are and how clearly you think about these issues, but by your equanimity. And I worry for you being in Washington, D.C., which we hear is an environment that can be at times quite stressful. And so perhaps it's not surprising you took on emotional stress as one of your issues. But do you mind sharing with our students, with me personally, I'm interested, how do you maintain your equanimity? What is your personal practice that has made you at least outwardly seem, at peace with the world? And I think inwardly as well, from what I know of you.
Well, now you know why I'm so excited to come to California, right? Well, for me, I will say I don't want to give anyone the illusion that I'm at peace 100% of the time and stress-free. I have my moments of stress and worry as well. But there are some things that I've tried to focus on in my life to anchor me to a place of centeredness and wellness. And some of those have been practices I do daily. So each morning when I wake up, my wife Alice and I meditate together. And that's one tool that we use to center ourselves at the very beginning of our day. We also do this 7-minute workout together, which is pretty cool. If any of you guys have read about it in the New York Times and tried it. But that actually ends up being an anchoring thing. The second thing that I do is I have a few words that I keep as talismans that I repeat to myself just in my mind when moments are difficult or stressful during the day. And those are love, peace, and happiness because they represent what I want to feel and what I want to express and share with the people around me and with the world. I'd say the third thing that I do is to really stay connected, as I was saying earlier, to my anchors, to the people who know me authentically. The wonderful thing about people who know you authentically is that they can remind you of who you really are, even when you forget. And so I try to speak. I speak to my family every day, usually, sometimes a few times a day, even if it's just for a minute or two here and there. But that helps keep me, anchored as well. So those are some of the things that I do. And I'd say the last thing is that I try not to react quickly or impulsively, because one of the things that I've realized, and I'm not always successful in that, but I've realized that sometimes like when you feel like reacting impulsively, that can come from one of two places, at least the way I see it. That can either come from a place of love or a place of fear. What I mean by love is love can manifest as inspiration, as compassion, as generosity. Your fear can manifest as anger, as jealousy, or as out-and-out fear. And one of the things I try to ask myself is, what is motivating me to make a decision, to say something, to take an action in a particular moment? And if it's some derivative of love that's motivating me, then I try to move forward quickly. But if I feel like I'm being motivated by fear, by the anger, by jealousy, by insecurity, then I try to pause and just take a breath and then wait until that feeling moves on. So those are some of the things that I do to try to stay sane in a sometimes insane world.
Wonderful. Thank you so much for sharing that with us. We're going to open this up for questions, and I'll invite you to come to the microphones and take our first question from there.
Hi, my name is Talha. I'm a first year in the medical school from New Jersey. And you issued a call for us to become physician leaders in our community. And a lot of us in the medical school, I'm sure we want to be leaders, but I feel like there's a difference between the things we engage in school, like research and health policy work, or even community activities, and eventually becoming leaders in the community, and that one is expected for us to do as physicians, and the other, like you said, doesn't happen as much anymore. And so I was just wondering how you think we should go about becoming leaders in our communities when we don't have a ton of physician role models to follow.
Well, that is a good question. And the search for role models is certainly one I very, very intimately remember, from my days in training as well. It's not always easy to find the right role model or mentor for yourself. But I'll share that before I was a Surgeon General, I had a couple of jobs, and one of them was working at an organization called Doctors for America, which was a physician advocacy organization that a few friends and I began together back in the day. And the reason that we actually began it was because of a feeling similar actually to what you said, which is a sense that we were contributing through the work we were doing in the hospital in our daily lives. But we felt that there was more that we wanted to do to engage with the community. We felt that there was more of a voice that we wanted to have when it came to ensuring that our healthcare system reflected the values that so many of us held, as practitioners. And so what we did is we just started small. And so many times when it comes to building, a larger voice for yourself, we tend to think that we have to achieve something very big right away. And that's not always the case. Many of the medical students I worked with, they began by writing, for example, letters to the editor in their local newspaper, just to share some of their experiences as a trainee, as somebody who was entering the profession, and talking about what they believed was needed and important in healthcare for their city at that time or for the country. That simple act of publishing or writing a letter to the editor became a way that they could have a voice and that they could actually share their views with the world. Others who I knew, medical students that I worked with, took a different path, and instead of working on writing letters to the editor, they got engaged with advocacy efforts in other ways. So they helped to also educate community members about important things that they may not know about. For example, in December we had a measles outbreak. There were so many people in this country who were confused about whether they should get vaccinated or not. A year ago, we had an Ebola outbreak in West Africa. You would think we had an Ebola outbreak in America from the news coverage. We didn't, but you would think we did. But that was also a time where the calming, reassuring voice of healthcare providers, including medical students, would have been incredibly helpful actually to have out there in the community. The thing is, you don't need to build an organization or to create a whole new initiative to have an impact in your community, to find your voice. It's about finding one place to start small. It's about thinking short term and not long term. And through that simple action, that first step, I think that you'll find that often doors will open to you for broader engagement.
Thank you.
Thank you. Over there.
Hi, so you named 3 kind of determinants of health that you wanted to focus on: nutrition, activity, and emotional well-being. And I feel like those 3 things are the least available to our most marginalized members of society. And with the discussions in the presidential election and proposed building of walls and xenophobia and homophobia and sexism and just classism in general, how do you think you'll be able to garner or just build support for improving the health of our marginalized populations, and what do you think a doctor's role in that is?
I think one of the most powerful roles that doctors can play is to help tell the stories of people who don't have a voice, and that includes the most marginalized in our communities. It's easy to ignore people who are marginalized because they often don't have power or clout. They're often not, there's no consequences of not paying attention to their needs. So those communities often need advocates. They need people who will tell their story, who will help others understand that they matter. And those people could be you. Those people need to be doctors. One other thing I would just share is that I think it's very hard we've encountered this many times, the situation where we have worried about a community that is not treated fairly. We worried about that in the 1960s, with regard to racism, and that's still a worry now. We've worried about that with the LGBT community and with concerns that members of that community are being marginalized in ways that they shouldn't be. We worried about that with folks who are economically disadvantaged. But I think that if we ultimately want to change and eradicate these divisions, if we want to get beyond people being treated unfairly in these disparities, we have to fundamentally change how we regard each other. Because unless you truly respect and value someone's life as equal to your own, it's very difficult to treat them in a manner that's consistent with the respect that they deserve, with the equity that all of us really deserve. And this has an impact when it comes to violence too. It's hard to hurt people who you truly value and respect as an equal, whose life you see as just as valuable as your own. And so then the question becomes for all of these, how do we cultivate that kind of a relationship and understanding in our country? How do we rebuild the fabric of America in a way that can enable people to be treated with the equality that's really at the root of our values as a country, but isn't always practiced or reflected in our institutions and in our laws? And so that's actually the question that stands before us. And I think the solution actually starts very locally. You can't legislate, for example, that people should treat each other with respect and dignity. You can try to do it in various ways. But ultimately, you can't legislate what people think in their heads or how they feel. But you can start to impact that by the interactions that you facilitate in communities, by the conversations that trusted people, whether they're faith leaders or other community leaders, have with the people who are members of their congregation or their community. So unless we address that and repair the relationships we have with each other, I fear that inequities will persist in our country. But the good news is that changing that starts at a very local level, and that means that all of us have the power to have an impact right away.
Go over to the side of the room. Yes.
My name is Jonathan. I'm a freshman here, but I just wanted to kind of like know your opinion on EMF radiation and how it's affecting the human population. What do you think we should do about it?
Well, that's a really good question and a very specific one. Radiation. You know, I don't have any great thoughts off the top of my head, to be totally honest with you, about EMF radiation. But I'd be happy to chat with you offline if you'd like. If you give me a few minutes to think about it. Okay? Make sure before you leave that you find Lieutenant Commander Eng right here. You want to raise your hand? Okay. Just give him your contact information. We'll make sure we get back to you with some thoughts on radiation.
Hi, I'm Linda Baer. I'm the director of CME here at Stanford. Thank you so much for coming and sharing your thoughts and plans with us. I was particularly intrigued with your discussion of communities and organizations and bringing them all together to be effective. And on that topic, and somewhat related to the marginalization question, what I wonder about as we see violence increasing in America, particularly gun violence, gang violence in the last couple of years, how you envision the Public Health Service working with communities, working with the criminal justice system to try to eradicate some of the issues that we have in the more marginalized populations where we don't have enough food and we don't have enough education to help us to eliminate tendencies towards gang life, violence, other things.
It's a really good question, and thank you also for asking particularly about the Public Health Service. Are any of you here familiar with the U.S. Public Health Service Commission Corps? For a show of hands. So a few people are. That's great. So the uniform that I wear is the uniform of the Commission Corps. Lieutenant Commander Eng, who's here with us today and who's based here in California, is also a member of the Corps, as is Lieutenant Anetta, who's around here as well. There are 6,700 officers in the Corps. They're public health professionals from across disciplines. Some are doctors and nurses, others are physical therapists, engineers, veterinarians. They're from a variety of disciplines. But what they're dedicated to is advancing public health in the country and around the world. And your question is great because for many years, the Commission Corps role of the Surgeon General and serving as the nation's doctor have been two almost separate roles in the office. And one of my goals is to bring those roles together and to engage our Commission Corps officers who are in 800 locations around the country and the world as local leaders and also as catalysts for bringing these coalitions together and enabling them to move forward on specific campaigns and issues around nutrition, for example, and around physical activity. With nutrition, as you mentioned, this is an issue that's so fundamental, right? It impacts everything. Despite the fact that it impacts everything, how come we're not all in the same pot investing in getting people the nutrition that they need? How come we're not investing more in shifting the choices that are in our own backyard, in our own workplace, to enable people to make healthier choices? Well, sometimes it's because people don't realize the power that they have or the impact that they can make. And other times it's that they don't know how to actually go about doing it. And that's why building these coalitions is so important. Because one of the things I've found as I've traveled around the country is that one of the most important roles that I end up playing is sharing stories between communities. When I go from Birmingham to Orlando, one of the first questions they would ask me in Orlando is, so we know they're dealing with obesity up in Birmingham, what are they doing to combat it, and how can we learn from that? This is where I think our Commissioned Corps officers can be really helpful. They can be conveners, they can be connectors, they can help share best practices and stories with community organizations that can help them find a path forward. But ultimately, it's going to take a lot of work. What we're talking about is changing a way of operating that we've had for a very long time, which is a very siloed way of interaction, where you have your job, you have your job, you have your job, and let's hope that it all comes together and forms a healthy, sustainable community. And we can't function like that any longer.
Thank you.
Thank you.
Hi, Dr. Murthy. Thank you so much for your comments and insights. My name is Vishnu. I'm an undergrad here. My question to ask is with regards to emotional well-being. So I wanted to know, how can you scale your national prevention strategy with regards to emotional well-being to college campuses, especially an area where we see so many college students suffering from mental health issues but unable to find the requisite access that they need, and with addition to the stigma that's seen on college campuses. So I wanted to know, how do you think we can scale those prevention strategies locally?
It's a great question. I think students have the power to create incredible solutions on campuses. Your name is Vishnu, that means creator, right? So you can create great solutions too. Just the other day, in fact, I was in Southern California. I was at the University of California in one of the branches down there, and I was peering over the terrace, and I saw this stand that was set up, which had an umbrella over it, which said "Mind Matters." So I asked him, I was like, "What is that?" And what it was is a student-driven effort, supported by the faculty and the administration, which is focusing on emotional well-being. The fact that it's driven by the students is actually really powerful. And I went down and talked to the students there, and what they told me is that they're helping to understand what people's state of emotional wellness or lack of wellness is, that they go around and help give people tools that might be very simple, tips about sleep, tips about stress management they may not otherwise have. And they're having a real impact on the community, on the campus. They're doing so not just because they're giving people concrete tools and tips, but because they're actually making it okay to talk about emotional well-being and wellness. At a time where, just a few years ago perhaps, for many folks on that campus, it wasn't so easy to talk about. So I think campus wellness is important. I think students actually can help drive the improvement of emotional well-being, both by helping provide tools to students, but also by making it okay to talk about that. And I think examples like what we just saw down in Southern California are great examples of how we can get started at any campus around the country.
I'm going to warn you that we have a limited time, so if we don't get to all your questions, please do forgive us. Question over there.
Hi, thank you for coming. I'm a third-year internal medicine resident at Kaiser, just visiting. So I understand there are way too many issues to be addressed as exemplified by the questions here today, but I'm going to ask mine anyways. So within the context of our medical industrial complex, given that about 3 million Americans are going to graduate into Medicare every year until 2029, basically the baby boomers, is there any space within the Office of the Surgeon General to address or to even talk about geriatric issues, as prevention is often, the time has passed for prevention for many of these seniors, and often moot because they've had their MI, their CVA, their complication from a chronic disease already. So I was just wondering if there's any space for geriatric issues.
There's always space for senior citizens in our office. So let me clarify one thing. It's never too late for prevention. And I say this not actually just philosophically, it's actually based on clinical data. We know that even if somebody has had an MI, even if they've developed diabetes, that engaging in lifestyle interventions, whether it's activity, whether it's nutrition related, whether it's around emotional well-being, can not only prevent potentially further impacts, but sometimes can serve as treatment as well. So this is an important message that we try to convey in everything we do, that you're never too old to engage in preventive measures, and you're never too sick either, with some, of course, extreme exceptions. So in our office, the way we're trying to address the needs of older Americans is to make sure that in all of the reports and initiatives that we build, that we specifically address how older Americans can get engaged in it. So in our call to action on walking, for example, we talked about what senior citizens can do to actually engage in physical activity and how that can help not just prevent illness, but help them manage the symptoms of existing illness, which is a big problem for many Americans. As we talk about nutrition as well, there too, there are challenges that older Americans face, not just in knowing what's the right thing to eat is, but in accessing healthy and affordable food. And in the same way that we are calling attention to walkability as a health equity issue, there too, we'll be looking at how to address the health equity issues involved in access to healthy nutrition for seniors as well. So obviously caring for our older adults is a complex problem. It surrounds issues of cost, of how we get high quality, integrated, coordinated care to seniors when they need it. But prevention is also a key component of that, and that's why we're emphasizing that in each campaign that we run.
I'm so sorry to tell you that we're out of time. The Surgeon General's on a pretty tight schedule. So sorry about that, but I know you had great questions lined up, and I hope we'll have another chance. I hope you feel how much you're welcomed here, how much Stanford loves you and loves your message, and we hope that we'll get to see you again and partner with you on some of the wonderful initiatives that you've started. So thank you so much for coming to Stanford.
Thank you so much, Abraham. Thank you, everyone.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.